All right, perfect. I guess we'll get started. Just to introduce myself, my name's Emma. I am currently a fourth year neuroscience and design student, and I am the project lead for Scouts Labs research and design team this semester.
Catherine, I'm a third year design major and I'm currently the senior designer for the Knox Clinic team.
I'm Michael Arnold Magus. I'm a seventh year Northeastern faculty. And I'm one of the faculty researchers that's part of their team.
And so today we're going to be talking about improving rural health access with Knox Clinic's mobile clinic project. And so this is going to be more so from a student's perspective of the work that we've done in this semester and then previous semesters. So just for some context, Labs has been working with Knox Clinic, who is a volunteer-based healthcare organization situated up in Rockland, Maine. So as you can see from like the little map, it's sort of along the more rural coastal side of Maine. So it has a very unique patient population. And so we've been helping them investigate the rural health needs of Knox County, Maine, as well as sort of the design of their service delivery of both their mobile health clinic as well as their new brick and mortar clinic as well. And just as some more context for the mobile health clinic, Northeastern's Bouvé College of Health Sciences over COVID donated their vaccination van over to the Roux Institute, which is Northeastern's main campus, and that the Roux Institute donated the van over to Knox Clinic, which is sort of how Northeastern is tied to the organization. And so it's sort of, the van has gotten a revamp over the previous year. It's got a new wrap. Scout has also done proposed like redesigns of the interior, and it's sort of currently in the stages of being renovated and up and running for use. And so just a little more introduction on our team. For my team in particular for Scout Labs, there's me, Catherine, Maya, Megan again, Amanda, Jasmine, Leilani, and Catherine, who are all working on this project. And then a lot of other stakeholders are involved at Northeastern as well, including CAMD professors. I know the communications team is also on it, as well as a lot of people at the Roux Institute and the Bouvé College of Health Sciences. All are working on different components and aspects with the Knox Clinic. And so just to go over some of the previous work that we've done in our first couple of semesters working with Knox Clinic, we've conducted a lot of literature reviews, community interviews, and surveys, and looked at census data to sort of compile key research themes that we saw when designing for rural mobile health clinics. And so what you see primarily on the screen is just like research collateral that we did. And so we sort of broke it up into four main themes of healthcare services, operations, patient experience, and then community outreach. And then based off of these findings, we also, as I mentioned, like redesigned renovation models for the existing healthcare van. And then we've also had opportunities to go up to Knox Clinic and workshop with their staff. We've developed service blueprints and patient journey maps based off of those conversations and interviews with both the Knox Clinic staff, community members, as well as other mobile health clinics around the area. We've done observational work at the Mass General Brigham Community Caravan that works around here, as well as have talked with a lot of the staff behind there as well to inform our service maps. And then we've also created preliminary ArcGIS interfaces, which is sort of the map you see on the lower right-hand corner, to visualize different community partners, populations, roads, other like key data that could inform like where we want the van to go, what services we want it to provide, and sort of what schedule we want the van to operate there. And so for this semester in particular, we have sort of four main deliverables. We have a wellness campaign, which is sort of strategy and messaging tailored to the Knox Clinic community. So we're creating visual assets like posters, flyers, and social media graphics promoting preventative care and sort of the clinic services. We also created wellness kits, so like curated hygiene kits and multilingual educational materials for different wellness topics and chronic disease management information. We're also doing an architectural exploration, which is pretty new this semester, where we're overlaying patient journey maps with their floor plans for the brick and mortar campus to understand how sort of like points of confusions or opportunities for wayfinding signage that we see in the existing architecture. And then we also created a mobile health clinic dashboard to sort of track operations, monitor patient engagement, and streamline scheduling and service delivery for the mobile health clinic in particular. So Catherine's now going to take us through some of the work we've done for our wellness campaign in particular.
Yeah, so we started by conducting a preliminary literature review to think about like what the people of Knox Clinic need to see and who we're targeting. So here's some of our research. We know that a lot of them are older adults, majority or some of them are uninsured, and many of them live within a wealth gap. So we wanted to make sure we were going to target people, like we were going to target specifically the people of Knox Clinic through our campaign. And so we started by doing some brainstorming on how we could create a visual language for our campaign. Here are some of our sketches of some ideas for posters, layouts, and we wanted to specifically do two different sides of it. We wanted to do brand identity posters that would just further the brand identity of Knox and make it more well known within the community, and also informational posters so that the people within Knox can get information that they need from these posters. So here are some of the ideation we had. We looked at other mobile health clinic advertisements and also medical institutions to see how they primarily put their information out. We also thought about slogans and what information we want to put on the poster. And specifically, we wanted to target our current slogan, which was your Mid-Coast Health Net, and we believe everyone deserves access to quality care, and to reword it to make sure that the people of Knox felt like they were being specifically talked to. So we created a new slogan that was your health, your community, your Knox Clinic. And so for our brand identity posters, here are some of the ones that we created. We used the Knox logo and also the color palette to make these like simple minimalist posters that still further the brand identity and used our different slogans that we had created. And here is on the left our first iteration of an informational poster that we later iterated into a more like minimalist but clean poster where all the information is very easy to understand, and it has the information like how to contact the Knox Clinic, QR code, and just some general information about what the clinic does, and also just a photo so that people can recognize it out on the street if they happen to see it in their county. And then next, we wanted to move away from just print material and also focus on social media, since the Knox Clinic does have a social media presence. They currently have Instagram and Facebook, but we noticed that the Facebook posts were like very photocentric, which was something that we really liked, but the Instagram posts were more like content heavy and also made with a lot of like Canva templates. So we wanted to make sure that they were to follow like the Knox Clinic's brand identity and to give information specific to the Knox Clinic, like how to access and reach them and to where to find them. So we started with making a social media strategy document. First, we started with the Instagram, where we wanted to make sure that the Instagram was more photo heavy so that it was more personable to the people within Knox. We wanted to utilize Instagram's different features like carousels, stories, and highlights to boost community engagement. We wanted to leverage short form videos to shed light on the clinic's message and to make viewers interact with and understand the clinic. And we also wanted to make sure that the content was community centered, so it felt more personable to the people that were the audience, and again to make a consistent brand identity through our posts. And then for our Facebook, and again, some of these apply to Instagram as well, we wanted to use hashtags like your Knox Clinic to boost engagement, tag locations that the Knox Clinic was in to increase visibility, and to utilize Facebook's longer form content by utilizing storytelling and community stories to convey the clinic's mission. And then just like for the posters, we did some research on existing social media. We looked at existing hospital social medias and other mobile health clinic social media presence to see what we liked and didn't like about their approaches. We did really like that there was a lot of visual consistency within them, but we didn't like that they felt so like sterile. We wanted them to still have like a personality of the brand identity, but to still give that content and follow the identity we mentioned before. And we also wanted the content to be tailored to the local community specifically, and again, not just to be like sterile. And so we started thinking about what different types of social media templates we could create. Some of the ones we thought of were like informational carousels about general health topics, community event recaps, patient stories, staff spotlights, and different resources that the clinic offers. And we, again, want to make sure it resonated with the community, but also that these templates would be editable by the staff at the Knox Clinic. So our goal was to make them in Canva, which we knew that Knox Clinic used before, so that they wouldn't have to have like a learning gap between those. And then the next few slides will be some of the social media posts that we made based on this research. The first is the clinic closed page, where these can be posted like day of or a few days in advance, and it'd be very easy to understand at a glance by people who need to get this information. And we made a lot of iterations for these. So on the left here, you'll see like our first draft, and then on the right here, you'll see our second draft after getting some feedback. And then these would be some photo recap posts. Like we mentioned before, we wanted to make sure they were very photo heavy. So these would be easy for the clinic to just drop a photo into and to post with some, photos or what they did that day. And then here's an example of an informational post that we made. This one specifically for food stamps, where they can scan this QR code or see a link in the bio in order to get access to this information. And then this is a staff spotlight post, which we thought would be important for community members to be able to feel comfortable going to the clinic and kind of see like who they might interact with when they're there and like who they'll work with. And then next we are moving on to the wellness kits.
So another deliverable that we wanted to create were sort of these curated hygiene kits for Knox Clinic that were both meant to sort of boost awareness about the clinic and their services, but also provide some health educational resources as well. So our team conducted some research to develop a comprehensive list of items that we typically see in different wellness kits, as well as sort of like the packaging modalities. We really wanted to make sure that the products we were including were useful and beneficial to and specific to the populations we were serving. So that informed some of our product choices, like hand warmers, bug spray, and other items that were targeting the population of rural coastal Maine, where a lot of the population are working outside. A lot of them are lobstermen. So making sure that we're like using products that they might want to use on a day-to-day basis was important for us. And so we ended up sourcing and compiling a list of these products in just like a Google Sheet or Excel format. We already knew that Knox Clinic had sort of a supply of Narcan, condoms, sunscreen, toothbrushes, and toothpaste. So we just wanted to add a list of resources in addition to that of where they could buy supplies in bulk. And then we created 3 different wellness kits at 3 different price points, sort of allowing the clinic to sort of mix and match depending on what they thought would be more valuable given the price point. And so one of the major cost limiting items we found throughout the whole process was like the package itself. So whether it be like a tote bag, like a zip up pouch, usually because we wanted the Knox Clinic logo to be like custom printed on that. And that usually involves 2 colors. That usually drove up the price a lot, which is what you'll see sort of in these next few slides. So these are just examples of the low, mid, and high tier price points. So it's for the most part, all of the products are the same, but just at varying price points. So we have like a tote bag as our package, and then we have items like hand warmers, like insect repellent, a first aid kit, face masks, tissues, hand sanitizers, lip balm, and stickers. And then for our mid-tier, it's sort of the same. We added a couple more items like a carabiner, for example, and like a magnet. And then for the high tier, it was sort of the same, but just expanding it a little bit more and having probably more full-size products or more branded products as a result.
Part of the wellness kits, we wanted to include health educational materials that would be easy for the people of Knox to understand and get like quick information from. So on the right here, we have some of the inspiration we have for these, which were like medical and nursing student pocket cards, which are easily portable and convey a lot of key ideas, but without being like too dense in content. And so we wanted to make sure that these were going to be easy to create and not too expensive for the Knox Clinic to produce. So we decided to make it the size of like a quarter piece of 8.5 by 11 paper so that, you know, they could easily cut them or get them printed and distributed. And one thing we really wanted to focus on was making sure that there could be an English and Spanish version so that everybody would be able to access this information. And then just for like the brand identity in general, we wanted to add like rounded corners to make it more approachable and potentially make it like a flip deck by adding a ring to give them access to like everything at once. And so the first one that we made was for diabetes. And as you can see here, we have things kind of organized into quick snippets of information, like quick facts, generally what is diabetes, the symptoms, and how to manage it. And then on the other side, we have it in Spanish. And then we have the same thing for high blood pressure with the same format, and also for flu vaccines. And one thing that we were thinking about doing if we were to make like a new iteration of this would be maybe adding like graphs or photos to, again, make it quicker information and not all like text heavy. And maybe photos of like, or like symbols of different symptoms and stuff like that to, again, get like quick information. And next we'll talk about the architectural exploration.
So as a reminder, the architectural exploration project is focusing more so on overlaying patient journey maps onto the floor plans of their new brick and mortar campus. So it's really a great way to understand how the patient is moving throughout the clinic spatially, and then understanding sort of any confusion points or opportunities for wayfinding through this mapping. And so to start off, we did a bit of research into patient journey mapping. So we looked into sort of videos and articles as well as interviews talking about in-clinic experiences and sort of how patients navigate throughout the clinic from sort of like pushing the front doors into receiving care and leaving to understand sort of care flow. And then we also did sort of observational I guess just called observations at local Boston health system. So I think we went to Beth Israel in the Longwood area as well as Fenway Atrius Health to just sort of get a sense of the architecture, see how patients were like moving through. Were they like confused at any points? Like how was the signage like helping them? Was it obvious like the signage or was it like really discreet? And so making note of those things to sort of inform our patient journey map as well as our overlays. And so in previous semesters, we did come up with a patient journey map. So we sort of built upon this to fit it more so for a brick and mortar service flow. As in previous semesters, it was made primarily for mobile health clinic journeys. And so we also included another column. You probably can't see it in this slide, but probably in the next. We have patient actions, support, pain points, and opportunities. And then we also added another row called sensory. And this sort of just incorporates sort of sensory touch points along the way that patients might interact with to understand the environmental factors involved. So this could be anything from like lighting, textures, signage, physical interactions people are having with staff, auditory stimuli that's going on, so we can sort of understand what's influencing patient perception along their journey. And so we're going to start, well, our plan is to establish one patient journey map. So in this case, it's the new patient for PCP annual checkup, and then sort of have that as a foundation and then create our overlays based off of that. And then in the future, we're looking to expand to different services like dental health, or maybe it's a returning patient or someone here for a specific this is a closer up look at our patient journey map. We do have plans to iterate it in the upcoming week, so it's not like fully up to date, but you can sort of see how we've numbered the different steps the patient takes throughout the process, from sort of presenting symptoms, becoming aware of the clinic, to scheduling, checking in, waiting, and then interacting with the provider, and then post-care treatment. And then we, as I mentioned, we have that sensory row as well, showing different environmental cues that the patient might be experiencing, as well as behind the scene, like support, like if they're interacting with the website, is there like a virtual chat assistant helping them, or, you know, different resources that they're seeing along the way, and then identifying pain points and then opportunities as well. And so when we're thinking about our floor plan overlay, we really wanted to visually emphasize the patient flow, and perhaps in the future even add like staff circulation as well to the clinic. So we're really thinking about abstracting the floor plans and not making them really nitty-gritty in detail, but more diagrammatic. And so we're really thinking about using color and like shape a lot as a way to convey emotion, and then different experiences patients have along the way. So you can sort of see from our examples, primarily we're going to, I think we're drawing from the leftmost graphic for inspiration, sort of that diagrammatic floor plan, and then showing like through arrows and like numbering the order at which patients are experiencing different parts of the process. And so these are sort of images of current ideas that we're doing. You can see the first one is like a preliminary sort of like sketch of existing floor plans, and then sort of mapping out where the patients will have to go through the clinic. We're planning on inserting sort of like pop-ups at each step to give more information about what the patient is experiencing, as you can see in the bottom here, and then showcasing sort of like directionality and flow through numbers and arrows, and also sort of planning to identify pain points and opportunities, probably through like the use of shapes, sort of like maybe like a circle overlay or some sort of color pop out, just to make it more apparent to the user. And then finally, we have our mobile health clinic dashboard. So this is a dashboard that it was created to go in tandem with the mobile health clinic service. So the idea was that the clinic staff could update the dashboard to fit their schedule for the week, and patients can go onto the website, find out like where the van is going, at what time, what services they're providing that day. And so if you scan the QR code, it'll like lead you to the GitHub that we have that's working, but I will also share my screen just to give a little more context of how it works. So this is the website we have here. So you have sort of like a calendar with different dates in them, and you can sort of see the different events or the locations that the van will be operating services to. And you can see sort of where it will be, from what times, the location, which you can view on a map as well. And then it also has more information like what services it'll be providing. So in this case, it's vision as well as wellness coaching. And then, you know, on another day, it could be like COVID boosters, blood pressure checks, flu shots. And so all of this can be easily updated by clinic staff through an Excel sheet, which is really nice. So it's a really simple user interface where they can just input the dates that they're, you know, servicing. So dates, time, location, as well as sort of the different services, as well as sort of location pinpoints. So it's a really easy way for the Knox clinic to update and maintain the web page even after handoff, which I think will be important for sustainability down the future. But you can also like filter by service types, which is pretty cool. And then there's also a map view. So on days where the van is servicing multiple locations, you can have like a more outer view of the different stops that the van is moving around, which is cool. And then we're trying to also keep the colors and the brand and the type all very consistent with what the Knox Clinic currently has. Let me switch back. Great. So just to wrap up, these have been projects that we've been working on sort of since last semester into this semester. So this is something we're going to continue iterating upon throughout the rest of the year. But we're really looking forward to expanding sort of the templates and elements that we've created for social media and the wellness campaign, as well as compile like a more comprehensive research deck of precedent examples and strategies to back up our designs. And then as for the wellness kit, we'd like to sort of conduct surveys in the local communities to understand whether or not they find these products valuable. Is there like one that they, would be more likely to invest in rather than another? And then in terms of the architectural exploration, I think this is where we're probably going to be doing the bulk of our work for the remaining time of the semester. We're going to create more detailed floor plans and overlays of the journey map and sort of expand upon more patient experiences as well. And then based off of sort of the findings that we get from the patient journey map overlays, this will also give us insights into opportunities for wayfinding and potentially designing those, as well as sort of different pain points or areas of confusion that we can find different solutions for. And then for the mobile health clinic dashboard, I think the next steps are really to curate an online presence, sort of boost community awareness about the resource, and then develop analytics for the dashboard as well. There's also been talk about developing or converting the dashboard into an app format. So that is also something that the teams are working on this semester as well. But thank you all so much. We are open to any questions you may have. And then we also have like prototypes of stuff that we made. So we have like our brand identity and informational posters, a wellness kit prototype, as well as some stickers, and then a 3D printed model of the redesign of the van. Just to note, the wellness kit is not like only the same as the one on the slideshow, just because sourcing is going to look a little bit different for smaller quantities, but that general idea is here. But yeah, thank you guys so much.
Someone is new to design in general. What are a few things that you would share with them? Michael can also help, but from the student perspective, like what is something that
What is design? What
is-
is question?
yeah. Anything you want to share about that?
Yeah, I can go first and then maybe Catherine and Michael can speak on it more. But I entered Scout Labs, which is sort of like the design research side of Team of Scout with like no experience in research design. I was like, I knew I was going to work on this project, but I like, had no idea what that totally meant before joining. But I think it's more so like a process of investigating and sort of talking to people and understanding the context of what you're working in. I think I come from a very like STEM background. I did a lot of like wet lab research before coming to Scout. And so that was sort of like my idea of research in a sense. But I like how design research is much more focused on sort of like the people you engage with and sort of like the stories they tell and how they inform your design decisions. So for me, that's what design research has been like. And I think it's like a great way to start if you're ever interested in like talking to people and understanding like where they're coming from to help inform your design.
Just to add on to that, I come from like the opposite side. I'm like all design major. So I think that like doing this project and just kind of understanding design research is like also understanding like who you're designing it for So that's why for like a lot of these, we took into account like heavily who we're targeting and like the abilities and like limitations of people within the Knox County. And I think that that's like the way to make sure that like the product will be like successful. Because if we had like, you know, maybe if like a lot of them speak Spanish and we had just made like an English version, we'd be missing like half the demographic that we were like trying to target. So
And you know, kind of like implicit in this question is like, why is this work important? I should say Stefania has been a big part of this. She's on the research team as well. So she's been like a big part of like motivating the work and like connected, you know, kind of been the critical connection to the scout team. But I would say like to come back to the question of like, why is this work important? Why do design research with this tiny little clinic that's like way off in the coast, 100 miles from any freeway? Every time you do design work with these people that streamlines, that takes work that the humans were doing in the clinic and moves it to an artifact, right? You're freeing up some of that clinician's time, some of the healthcare, you know, some of the different healthcare providers that work there, you're freeing up their time. You're freeing up the administrative staff to work on, you know, like, does this person who just came into the clinic, do they need, you know, can I make a phone call to follow up with them to see if they're going to their next appointment? Like this is like the design work is taking on some of the workload of these clinic staff. I mean, I don't want to say like saving lives, but you're freeing up other people who are working there, who are doing the life-saving work to do that better, right? So this design work is really quite important. And the more that we can delegate to the website, the posters, the clinic map, the service plan, right? The easier the jobs are for the folks that work at the clinic, and the better the experiences for the patients who come in, makes them more likely to want to come back. So it's great work. It's super meaningful.
Yeah.
I was wondering because like I feel like the hardest part of design to me is like research to me is like getting started. Do you have any like tips on where to begin when it comes to research?
Yeah, I guess we can touch on it first. I think, you know, we live in such an like digital information age. Like Googling is definitely like my first step every single time, seeing like what research is already out there, what people have already done on the topic. A lot of when we initially started this project, specifically in terms of like the mobile health ban, a lot of our research was, you know, looking at literature reviews, finding other mobile health clinics and reaching out to them for like interviews, like informative interviews, and then compiling all of that and sort of analyzing key takeaways from what they were talking about, and then, you know, issues that we were considering for our mobile health clinic too. So like from an operations perspective, like a lot of them were talking about, oh, like does, you know, the community partner you're partnering up with like have a bathroom? Do they have a generator? These are all like aspects you probably like wouldn't really hear about just from like Googling and like reading literature, like academic papers. So I think it's like a combination of starting off online and then having from reading those resources, prompting you to want to understand more and finding the right people to contact to do so.
yeah, and to add on to that, I think like a lot of the places we started for the design specific parts was also online. As you could see from like a lot of the inspiration that we had. But I think also just like iterating on the different things that we made and kind of talking amongst ourselves to get like feedback was a really great place to like get more ideas. And maybe if that's not like the place we started, like I think that that's the place where we were able to like generate the best ideas by like talking through different ideas and iterating on everything. So
I have many questions, but I will just ask one first. And in the communication campaign, why did you decide mainly on social media and not traditional media channels? Like, was there a process where you talked with the community and the people around it, mentioned what were the channels and normal media outlets that they used to get information about? And social media was the primarily, or was it like a choice because of funding and budgeting?
I think that was something that we kind of saw as like a challenge at some point. Since some parts of like Knox don't have access to like internet, we wanted to make sure we had both social media and also print. But we did see that like a problem with doing just only print was they would have to be in community centers that everybody in Knox Clinic would go to, or in the Knox County would go to, which is never easy to like predict. So we wanted to make sure we were able to cover both bases, but the posters that we made were going to be able to give like, you know, the information that was needed and be able to be put in these community centers or distributed by Knox into other channels, but also so that Knox can maybe share these social media posts and if someone is like learning through word of mouth, maybe they can see it on social media from someone else. So we wanted to make sure we covered both bases, but that was something that we kind of struggled with was how do we like make sure we're accessing everybody when not everybody has internet access. So
But also confirm, yeah, both.
yes.
But both print, not radio, TV, like beyond traditional channels.
I think that part would be like a budget concern with like advertising on TV. I think Knox Clinic's budget primarily needs to go to like their health materials and their like services. So we wanted to make sure by like the print materials and the social media, maybe they were like easy to just make on like a normal printer or like would it cost more than like $100 to do? So I think like in an ideal world, if we were able to go through TV or radio, that would be a good option because a lot of people, like I mentioned, don't have access to like traditional social media. But I don't think that the Knox Clinic has like the budget for that at the moment.
Maybe a local.
Part of the problem. Oh,
Local media, like interviews, podcasts,
Newspapers, local radios.
like guests invited.
They have there's a community radio station that's out of Belfast. And we've had some conversations with them, but you know, it's really like it's like one person, you know, in a room playing, you know, playing radio off a computer. There's not a newspaper like in the way that we think like the Boston Globe that covers this area. And the nearest TV station is in Portland. So, and they're really the TV station for the state. So the media, you know, 50 years ago would have had it, I'm sure there was a town newspaper.
And
So I
how
think,
do they
yeah.
find out then, like the community on their own, like how do they find out about things around themselves? They manage to like get some of that participatory way of asking like what sort of media were they using?
Yeah, when we like discussed with the Knox Clinic, one of the things that they mentioned was putting posters in like the community centers, and they already do like the social media like advertising as we saw before. So those were two channels that they mentioned that they want to use and have been using. And yeah,
Yeah. I can add on. I think additionally, when we were doing informant interviews with other mobile health clinics around the country, a lot of them mentioned that their van would park at different community partner sites. So like schools, libraries, senior facilities, government buildings. So I think that was also a way to raise awareness in communities for those who, you know, have kids or like frequent, you know, local parks or, you know, different community resources to sort of hear by not like word of mouth, but also from trusted, established community members as well.
Well, and this is a little bit before this team was part of the project, but one of the purposes with the van redesign was for the van itself to be like a rolling advertisement. So for a while, I think for like almost a year and a half, there was no functional interior of the van, but they would just drive it to like county fair and park it, you know, so people would see that, oh, there is a Knox, you know, there's a community health. There's a health clinic in our neighborhood that serves, you know, underinsured or uninsured folks. Yeah, so that like physical is key. Like as their poster, you know, they show their poster project is you know like it's another one of those key environmental graphics. You're right.
No, no, right, just one.
I was gonna ask, did you have like any, or did you, or do you plan to, But specific patients at Knox, like, have, with their experiences there, or like, touch on that? Like, did you, talk to the patients that have already been going to Knox, or? um,
Yeah.
See their views, experiences?
Yeah, I think in the initial like planning steps of the mobile health clinic, our team was able to go up to Knox County and they sort of had an organized I don't know, like fair, so to speak, where we sort of like tabled and were asking people questions about, their thoughts on the mobile health clinic. What were they like most excited for? Like what were their sort of apprehensions about it to gain a better, sense of, other people's like opinions. But I think through our interviews, we had a lot of different people with a lot of varying like opinions. Some were like super ecstatic about having a new health clinic in their area that were serving specifically their demographic. But then we also had people who were sort of more intimidated by sort of like Northeastern as a big, large organization coming into their small, close-knit community. And that sort of like also made us sort of shift our research into looking more into community partners as a way to raise awareness rather than sort of doing the advertising like ourselves.
A lot of your work with the informational posters and posts and reducing it to highlightable, understand type of things. So how do you decide what information is best to be highlighted and what's the research process behind that? And then how do you kind of handle like the ethical responsibility of delivering highlighted information?
I think the first thing that we started with was asking the Knox Clinic what topics they wanted us to cover. And if you go to the slide with the diabetes one, we were given like informational like an already made informational thing from like the American Heart Association that had all the correct information to start with. And we went off of that. So we knew we were getting the right information because it was from a trusted source that we knew was going to give us like what was actually accurate. And from there, we made sure that we were going to like get the biggest topics like the symptoms, what is it overall, how can I manage it? And we also wanted to make sure that, since there are like very complex topics, they're sometimes hard to like cover in just a little card like this. So at the bottom, we have a link that says, for additional resources or more information, you can go to the Knox Clinic website where they would be able to get like more of that information and at a deeper level than what can be given on this card. You want to add more?
Additionally, we have another team at Scout Labs who are working to create a more interactive and digital version of the health educational resources that we see here. So I think in theory, we would like either have, the link to that website or a QR code within these pamphlets that will direct them to a website that has a lot more information that's a lot more like comprehensive and like up to date. But I think in terms of like distilling the most important points of our research, it really comes down to the fact of like what do people like have to know to be informed about this topic and to receive care and seek that out is sort of, I think, our thought process behind it.
Another question is, during the campaign, what were some of like the measurements that you established for success or the impact? For example, are you measuring social media engagement, views, or are you measuring like patient satisfaction? What are some of the ways you're measuring the work that you're doing in the community?
Great question. I think a lot of the work that we've shown here are still like works in process. So they haven't actually been sort of like distributed or sort of like shown to the community in a sense. I think for the dashboard, that's something that's gonna be a lot more visible to sort of get analytics from, like depending like how many people are like coming to the website, how many people are like showing up to different service locations. I think distilling analytics from that will be a lot more simpler, but I think for the other things that we've mentioned, it sort of hasn't really been like put up to use yet since it's still like in a work in progress.
As a doctoral student, I think this question is a really good one. What might end up happening with the dashboard is that the analytics might not,
Right.
couple ways to answer this question. Sue Mello is part of our team who's in communications, and she does a lot of work with like creating the sets of evaluative metrics that you'd use with a communication program. So that's like kind of when these guys get done, then Sue will take over and like help the clinic understand, how successful have these programs been. The other thing that I would argue is that this dashboard might end up being a tool that's more useful for the in-house staff rather than because it's a little bit of a, Emma mentioned, the population is quite a bit older. So a lot of them are like calling into the clinic to be like, hey, where's the van gonna be? And then the, clinic worker pulls up the dashboard and looks to see like, oh, when's it gonna next be by me? The clinic worker, uses the dashboard. So then we might end up just generating like thousands of hits from the clinic itself versus like the ideal would be that older person looks on the website, but like in reality, that probably won't.
But that was going to be one of my questions. If you have like a specific call center or like a specific line of attention that would be able to help the people navigate the services around and like help them move around the like not only the website but the services and like for example, if you have the posters that someone is asked, how do I know if I have diabetes, right? Like your own nowadays ChatGPT, but now you have like a real call center that it answers this sort of thing.
Sorry, I laughed when you said call center first because the non-clinical staff of this place is like 5 people.
Oh.
One of them is the executive director and the other is like head of personnel, and then they have like receptionist is like goes the hierarchy is really flat. So like when I said earlier, like any work that these guys can do to offload work from it really has a meaningful impact. What was your question, Ken?
I mean, the original question was the metrics of success, but the consecutive one was if there was a number that was added into the services, because I assume if it's rural adults that they would be more in a phone than going and use an app or social media. And I do have that sort of like, I don't know, nowadays with the chatbots, but I still don't like them for older adults. But still to have that way of that person will call.
More getting the outcome of the research, so I was curious to hear how much the research was on conversation and how much did you do observation? And the second part of the question is from the insights, what quantitative insights you think you got from the interview? Like critical.
So it's very hard to pinpoint just like thinking about it in general. I would say like 10% to 15% comes from like straight literature review in our initial research. And then I would say a good, I don't know if this is going to add up to 100, but 30% would be from like informant, 30 to 40% would be like informant interviews, so quite a substantial amount. And then I think like talking with community members would probably also make up a smaller percentage, like 10 to 20%. And then the Knox Clinic themselves in previous years ran their own surveys with interviews from the community. So that's also something that we heavily relied upon. And so I think that with that survey, which is like pretty comprehensive, probably takes up around like 40%.
You mentioned going into the hospitals here to kind of see.
Yes, I would say that's like 15. It wasn't, I think we've only done like 3 observational visits, just because we were only able to witness the Mass General Brigham Community Band for one weekend. They're actually hosting like an event at a local school, which is really cool to witness. And then we did like 2 other observations just at local like hospital systems. So I think while those were informative, I don't think they were sort of like a key driver to a lot of our design decisions.
Also, the state government of Maine annually conducts the CHNA Community Health Needs Assessment, and so that's in your percentage scale. That's probably like 5% or 10%, somewhere in there.
Yeah.
It's another, you know, kind of key. Through, yeah, oh, go ahead.
We just have a chat question that's sort of related to what you just mentioned. Someone's asking how many ride-alongs in the van did you do? And then what's the patient problem you can actually solve with limited time, budget, design, etc.
I personally haven't done that right along. I think that's for the time I was up in Knox Clinic, the van was like not up and running. Like it was still like the old van. Like I helped take off the old Northeastern van raft. So it was like very not much up and running when I went. I'm not sure if other people who have been working with Knox Clinic have done sort of a ride along because I know they just sort of started flu vaccination services, if I'm not correct. But in terms of immediate patient population products we can solve, I think once the van itself is up and running, it increases access to care for so many patient populations. As I mentioned before, we have quite an older uninsured population, and then a lot of lobstermen also fall into that category. So they work like sort of like odd like hours, like they don't work a standard 9 to 5. And so having a mobile clinic with sort of a different range of meet times, I think is really important to like access care instead of like driving like, 40 minutes to the nearest hospital.
Yeah, and coming back to the question of the patient problem, a lot of the work that the van does is providing like the initial awareness that the clinic exists. So you're not going to be receiving like nobody's going to put a pacemaker in the back of the van, right? We're not having major surgery in this thing. It's more like we're going to get vaccines, we're going to get information, we're going to become aware that these people exist and can be trusted. Maybe like the fishermen, retired, lobstermen and fishermen getting critical care at the point when they come off the boats. This is so, for like minor injuries, and also RSI, repetitive stress injury, is a big challenge for rural fishermen. So, having that care there at the waterfront when they come off the boats is kind of critical to capturing that population. So, and again, I'm just kind of repeating myself, like the number one goal is to get people aware of the clinic. But there's also, the option, the opportunity, which is still in development, of providing mental health care, especially addiction recovery services. A lot of folks, as you can imagine, retired lobstermen, repetitive stress injuries, work-related injuries goes hand in hand with substance addiction. And so, if this can provide services to, harm reduction out on these, peninsulas where they're like 10, 15 miles from anything, for retired folks that might be having trouble with that, that's another patient problem.
And is there like plans to expand the services, for example, to bring medication, like to be able to make appointments, for example, that that it's going to be around and there's specific services and you can make an appointment, and then perhaps the clinic can also bring the medicine for the people that, because one part is accessing information, but in this country specifically, accessing medicine is also another issue without insurance, right? Like, is there a way where they can have like a medicine without having to have insurance that won't cost them an eye?
The clinic the main site, do you want to?
No, I don't.
The main side of the clinic has plans for a pharmacy as part of their renovations. So this is kind of like a multi-phase project.
But there's a pharmacy right
Yep, yep. Which is probably not done yet. Last time I was up there, it was like where they were keeping the drywall for the other renovation stuff. So they're doing the patient-facing services side first versus scaling up new services. But yeah, yes. That's
like
fine.
expensive plans. Okay. Question.
Last question.
Sorry, Malo, you're touching on one that the topics I'm most curious about. In part of like the campaign, you mentioned the use of storytelling and community stories. But I think it's a bit broad, so I want to know more about what do you mean by storytelling? What stories? Is there a specific format? How were these stories from the community and then reused? Were these like overall stories about health? Tell me more.
I think we had like a few ideas on different types of stories we could tell. I think one that we would like to share is like maybe patient experiences. Like if somebody is going to the health clinic for the first time and doesn't really know like what to expect, it could be like someone's experience saying like I had a good experience, you know, I felt very comfortable, so that anyone else who's reading that can feel like more comfortable. I think we'd also want to tell stories from like the staff so that like we mentioned with the staff faculty or staff spotlight, that they can kind of see who they're gonna like to talk to and like who they're gonna get to know. And then I think it would also be like nice to just kind of share the overall story of Knox Clinic in general so that the community knows like the goal and like why they want to, you know, help. And so they can kind of build like a more trusting relationship with them. Do you have any other thoughts?
Yeah, I think sort of capitalizing on sort of that local community sense when we're talking about storytelling is like really important. Like Catherine mentioned, like patient-specific stories, staff spotlights are all great tools. And I think like as the clinic becomes, you know, has more patients and has like is like servicing for a longer period of time, maybe more longitudinal stories of patients either like recovering or sort of their experience with their treatment at Knox Clinic, I think would be another great asset. Great. I guess that's time. Thank you all for coming. We have prototypes if you guys want to take a look. Feel free to take a sticker. We have so many stickers. But thank you so much. Yeah, we'll probably stick around for the next couple of minutes if you have any remaining questions. But thank you so much.
Thank you.
Thank you.